It's incredible how much information swirls around healthcare these days, isn't it?
Oh, definitely.
Trying to distill it down to what truly matters for, better decisions can feel like navigating a maze.
It really can.
Yeah.
The sheer volume of data generated, in the healthcare ecosystem, it presents both a huge opportunity and, well, a challenge.
Right.
The key is understanding how organizations are sifting through all that noise to drive meaningful improvements.
And that's precisely what we're diving into today. We're going to explore how healthcare organizations are using data to make smarter choices.
Yeah.
Not just in how they treat individual patients, but also in how they manage their operations and plan for the future.
And to get a really comprehensive picture, we've drawn from an interesting mix of sources. We'll be looking at insights from Joint Commission International JCI
Right.
and the National Accreditation Board for Hospitals and Healthcare Providers, NABH for short.
NABH, got it.
Plus perspectives from Supremediq Consultancy, the International Society for Quality in Healthcare, that's ISQA, and even a really relevant episode of the QI Playbook.
Wow, quite the collection. A real treasure trove of information. Our goal, as always, is to extract those crucial insights, those kind of light bulb moments, so you, the learner, can grasp the core of this topic without feeling, completely overwhelmed by the detail.
Exactly. Cut through the noise.
So let's get right to it. Why is data such a fundamental cornerstone of modern healthcare? What's the big deal?
Well, fundamentally, data empowers healthcare to move beyond intuition, beyond guesswork, and rely on actual evidence.
Okay.
Think about clinical decisions. When doctors, nurses have access to robust data, they can make diagnostic and treatment choices grounded in what is actually proven most effective. The QI Playbook highlighted clinical decision support systems as a prime example of this.
Yeah.
These systems analyze patient data against like a vast knowledge base to offer clinicians tailored recommendations right when they need them, at the point of care.
So it's about anchoring those critical decisions in something concrete, something real.
Precisely. And this isn't just about individual patient encounters, is it?
Right, it's broader than that.
Oh, absolutely. Data acts as a powerful lens, really, allowing organizations to pinpoint areas that are, well, ripe for improvement.
Okay.
By consistently tracking key quality indicators, things like the rate of hospital-acquired infections or how often patients need to be readmitted, data can flag emerging issues. If, for instance, readmission rates start to trend upwards, the data provides that crucial early warning signal.
It helps identify where the friction points are, the problem spots.
Exactly.
But how does that translate into the day-to-day efficiency of a hospital or clinic?
Well, that's where analyzing operational data comes into play, by looking at patterns in patient flow.
How smoothly patients move through the system.
Yeah, exactly. And staff schedules, utilization of resources like equipment, beds. Hospitals can identify bottlenecks and inefficiencies. The QI Playbook had a great example of analyzing emergency department wait times during peak hours. This allowed for strategic adjustments to staffing.
So more staff when it's busiest.
Right, which led to tangible improvements in patient flow, less waiting around.
That makes perfect sense. Streamlining those processes, it benefits everyone, patients and staff.
Definitely.
Looking at the bigger picture then, data also informs those long-term strategic decisions, doesn't it? The planning.
Absolutely. For long-term planning, data is, well, it's the central roadmap.
Okay.
When a hospital considers expanding its services or maybe investing in new tech, it needs data on patient demographics, changing healthcare needs, treatment trends.
All that background info.
Yeah, to make informed decisions about where to focus its resources and efforts for, maximum impact.
Okay, so data is really the engine driving improvement across the entire healthcare spectrum, clinical, operational, strategic.
That's a good way to put it.
Now, let's delve into the specific types of data that healthcare organizations actually work with day to day.
Sure. We can broadly categorize this into several essential streams. First, and maybe most obviously, we have clinical data.
Right, the patient-focused stuff.
Exactly. This forms the core of patient care. It covers everything from the patient's medical history, their diagnoses, treatments they receive,
Test results,
how they respond to treatments, medication records, and critically, their clinical outcomes. Did the treatment actually work?
Got it.
As the QI Playbook emphasized, scrutinizing this data lets professionals see which treatments are most effective, spot patterns in patient health, and ensure they're sticking to evidence-based best practices.
Okay.
They even mention clinical dashboards offering a real-time snapshot of a patient's condition, allows for timely interventions.
So that paints a detailed picture of each patient's journey. What about the data reflecting how the hospital itself operates?
That falls under operational data. This looks at the inner workings, the mechanics of the organization.
Okay.
We're talking about things like patient flow admission to discharge staff schedules, how efficiently people are deployed, utilization rates of key resources like operating rooms, imaging equipment, and of course, those crucial waiting times in various departments.
Right, the waiting times everyone notices.
Exactly. And as we mentioned, the QI playbook showed how analyzing ED wait times against staffing levels can really pinpoint where to optimize, make the system more efficient.
Right, making sure the system runs smoothly. Then there's the financial health of the place.
Precisely. Financial data is vital, absolutely crucial for long-term viability.
Makes sense.
This includes all the info related to revenue, expenditures, billing, coding, overall cost management. Leaders rely on this to make informed decisions about budgets, resource allocation, strategic financial planning.
You need the money side sorted to provide good care.
You really do. Analyzing billing data, for instance, can reveal inefficiencies in coding that might be hitting the bottom line.
Ah, interesting. What about understanding the patient's experience, like from their point of view?
That's captured through patient experience data. This focuses on quality as perceived by the patients themselves.
So feedback?
Yep. Feedback from satisfaction surveys, patient testimonials, even formal complaints. By analyzing this data carefully, hospitals can find areas where patients feel improvements are needed.
Like communication or waiting.
Could be anything: communication, staff responsiveness, even the comfort of the facilities. It ensures that human element is measured and improved.
Good point. And finally, there's the data for meeting regulations, right? The compliance stuff.
Exactly. Regulatory and accreditation data. This is all about compliance with standards set by bodies like NABH, JCI, government agencies.
Okay.
Organizations have to collect and analyze this data diligently to prove they're meeting these benchmarks. It's essential for keeping their accreditation, meeting legal obligations, and ultimately driving overall quality and safety.
Okay, so we have a good handle on the different types of data involved. Clinical, operational, financial, patient experience, regulatory.
That covers the main buckets.
Now, how do healthcare organizations actually use this data effectively? How do they leverage it to make those better decisions we've been talking about?
It's really a systematic process. The first critical step, as the QI playbook highlighted, is to collect relevant data.
Not just any data.
No, not just hoarding data. It means clearly defining the decisions you need to make and then strategically gathering the data that will directly inform those decisions.
Okay.
Using key performance indicators, KPIs, is really effective here. If your goal is, say, improving patient satisfaction, you need to actively collect data specifically on patient satisfaction through surveys, feedback channels, etc.
So purposeful collection. Makes sense.
Precisely. Then, once you have the right data, the next crucial step is data analysis and interpretation.
Making sense of it all.
Right. Raw data points alone don't tell you much. This is where tools like data visualization charts, graphs, dashboards, and statistical analysis techniques come in.
Seeing the patterns.
Exactly. The QI playbook touched on key approaches: trend analysis, seeing changes over time, root cause analysis, digging into why something is happening, benchmarking, comparing your performance to others. User-friendly dashboards are especially valuable here. They present complex data in an easy-to-digest visual format.
So you can actually see the story the data is telling. What happens after the analysis?
Then comes the vital step: making data-driven decisions. Sounds obvious, maybe, but it involves consciously using the insights from your analysis to guide your actions.
Okay.
Like the examples from the QI playbook. If data shows lots of side effects with a certain drug, you might decide to switch.
Makes sense.
Or if ED wait time analysis shows consistent peaks at certain hours, you decide to adjust staffing then. The key is basing decisions on evidence, not assumptions or just how we've always done it.
Moving from gut feeling to informed action. Got it. And once a change is made, that's not the end, right?
Absolutely not. You must then monitor and measure the impact.
See if it worked?
Exactly. Are the changes actually leading to the desired outcomes? If you started a new training program to cut medication errors, you need to track those error rates after the training to see if it was effective.
Closing the loop.
It's a continuous feedback loop, fundamental for ongoing improvement.
And it sounds like this whole process needs to be embedded in the organization's culture.
That's the final critical piece: fostering a data-driven culture. It's more than just having the tech tools.
Right.
It involves educating staff on why data matters and how to use it, having leadership actively champion its use, showing its value, and being transparent about the data so everyone understands its role.
A complete shift in mindset, really, from top to bottom.
Yes, exactly.
Now, it's always helpful to see concrete examples. Can you share some real-world scenarios of data in action, how this plays out practically?
Yeah, the QI playbook gave some excellent case studies.
Yeah.
One involved reducing hospital readmissions.
Always a big goal.
Definitely. By using predictive analytics, basically, computer models to identify patients at high risk of coming back soon after discharge.
Okay, finding the vulnerable ones.
Right. The hospital could then implement targeted interventions for those specific patients. Things like proactive follow-up calls, maybe home visits.
Ah, focus support.
Exactly. And this data-informed preventative approach led to a noticeable drop in readmissions. These models often look at things like specific diagnosis combinations, even social factors.
That's a powerful example, using data to anticipate and prevent problems. What else?
Another focused on improving emergency department wait times. We touched on this.
Right, the staffing example.
Yeah. Through meticulous analysis of operational data, they identified specific peak hours and bottlenecks in their triage process.
The choke points.
Exactly. That insight allowed them to strategically adjust staffing levels and streamline how patients were initially assessed and moved through during those critical times.
And the result?
Directly resulted in shorter wait times and, naturally, a better patient experience.
Definitely a tangible improvement patients would feel. Any other key examples?
They also illustrated data use for enhancing infection control.
Another critical area.
Hugely. By rigorously tracking infection rates across different hospital units and patient groups, they identified one particular department where hospital-acquired infections were creeping up.
The data flagged it.
Yep. That triggered a focused investigation into why. What were the root causes? This led to implementing more stringent infection control rules specifically tailored to that area's issues. Ultimately, a significant reduction in those infections.
These real-world examples really hammer home the practical power of data. It's not just theoretical.
Not at all. It translates into real improvements.
Now, stepping back a bit, considering the broader implications, we also looked at some overarching perspectives on data analytics in healthcare. What were the key takeaways there?
Well, the information we reviewed strongly reinforces those fundamental benefits we've discussed. Better patient outcomes, optimizing resources, streamlining operations. No surprises there.
Right.
But it also highlighted some other compelling applications. For instance, the growing potential for truly personalized treatment plans.
Tailored to the individual.
Exactly.
Yeah.
Developed through deep analysis of someone's unique data profile. And even the exciting possibility of predicting and preventing medical emergencies before they happen.
Wow, like using wearable data.
Potentially, yeah. Imagine using data from wearables to flag early warning signs of, say, a cardiac event. That's powerful.
That sounds like a huge shift towards more proactive, individualized care.
It really is. And real-time analytics is a key enabler here, allowing for immediate interventions, continuous patient monitoring. And it's not just direct patient care. Data analytics is also revolutionizing things like optimizing staffing levels and scheduling operating rooms much more efficiently.
Getting the most out of resources.
Far more efficient use of valuable resources, which in turn contributes to reduced healthcare costs. By spotting patterns in patient flow, readmissions, maybe even identifying fraudulent claims.
So it hits both quality and the bottom line.
Exactly. Plus, it drives improvements in data management itself, streamlining administrative processes, making the whole system run better.
More efficient all around.
And it's a crucial driver of preventative care. Using predictive analytics to find people at higher risk for certain conditions, allowing for timely interventions, lifestyle changes.
Catching things earlier.
And as we've said, it provides that essential evidence-based foundation for clinical decision-making at every level.
And it's even pushing medical science forward.
Absolutely. Data analysis plays a vital role in accelerating research and development, helping identify trends, patterns, correlations in huge data sets, which can point towards new treatments, new prevention strategies.
Amazing. Did the sources mention specific tools being used?
They did. Things like electronic health records, EHRs, obviously, for real-time data access and efficiency. Sophisticated predictive analytics for forecasting admissions or even predicting disease outbreaks.
Wow.
Analysis of claims data to assess care quality and find cost savings. And the increasing integration of genomic data paving the way for truly personalized medicine.
It's just astonishing the breadth and depth of impact data analytics is having. Really transformative.
It truly is.
Now let's turn our attention to the role of accreditation bodies like JCI and NABH and all this. How do they fit into this picture of data-driven decision-making?
Well, these organizations play a really pivotal role. They establish and promote the standards for quality and patient safety.
Setting the bar.
Exactly. And the effective use of data is often a cornerstone of those standards. Joint Commission International, JCI, is a global leader here, setting rigorous international benchmarks.
Right, the international one.
Their whole mission is about enabling organizations worldwide to achieve and sustain the highest levels of quality and safety. They work in, I think, over 70 countries, accredited thousands of programs.
They have wide reach.
Huge reach. And while their intro materials might not explicitly list data-driven decision-making as its own pillar, their strong emphasis on measurement, assessment, continuous improvement. Well, that inherently requires robust data collection and analysis.
It's baked in.
It has to be. Testimonials from hospital leaders on their site often mention benefits like better risk management, stronger patient safety cultures, which are often directly tied to using data effectively.
Makes sense.
And JCI offers more than just accreditation standards. Their international patient safety goals, advisory services, education, all invariably touching on the critical importance of data.
Okay, so they set the global standard, and data is key to meeting it. What about NABH? What's their focus?
NABH, the National Accreditation Board for Hospitals and Healthcare Providers, is part of the Quality Council of India. Their focus is specifically on accreditation programs for healthcare organizations within India.
Tailored for India.
Right, aiming to set benchmarks for the Indian healthcare sector, addressing consumer needs there. And similar to JCI, getting and keeping NABH accreditation means adhering to comprehensive standards that, again, almost certainly involve systematic data collection, analysis, and use for continuous quality improvement.
It seems like a common thread.
It really is. The fact that consultancies like Supremediq specialize in helping hospitals get NABH accreditation highlights the rigor involved.
Right.
And NABH is linked with ISQA, the International Society for Quality in Healthcare. ISQA promotes quality improvement globally through education, knowledge sharing, external evaluation. So that underlying principle of using data is a shared value across these key organizations.
So these accreditation bodies, international and national, are really essential drivers in fostering that culture of quality and safety.
Exactly.
And that inherently relies on using data smartly and effectively.
Precisely. They provide both the framework and, frankly, the motivation for healthcare organizations to prioritize data as a fundamental tool in their pursuit of excellence.
Well, this has truly been an illuminating deep dive, really clarifies the crucial role of data in modern healthcare.
Glad it was helpful.
To quickly recap, it's crystal clear that data isn't just, a nice to have anymore. It's an indispensable foundation for enhancing quality and safety.
Absolutely. By making evidence-based decisions across the board, clinical care, operations, strategy organizations achieve demonstrably better patient outcomes, boost efficiency, and ensure they're sustainable long-term.
Right.
And accreditation bodies like JCI and NABH provide those vital frameworks and standards that encourage and support these data-driven practices.
And for you, the learner, we really hope this deep dive has provided a clear, insightful shortcut to understanding this vital topic, giving you a solid grasp of how data is fundamentally reshaping healthcare's future.
Which leads us to a really interesting question for you to ponder. Given the ever-increasing volume and variety of healthcare data becoming available, think sophisticated imaging, personal wearable metrics, detailed genomic info, how might this continuing data revolution further transform patient care and the very structure of our healthcare systems in the years ahead?
That is a fascinating question.
It's a truly exciting frontier to contemplate. What does the next evolution look like?